Welcome, everybody. I'm Penny Calvert. Please excuse me reading from notes. It's because I get A, very nervous, or B, waffle on. So it's to keep me on track. So welcome everyone, both here at Wiltshire Music Centre and those of you joining us on the live stream and perhaps in the future watching us on YouTube. I'm Penny Calvert, one of the Creative Health Associates team. There are 7 of us across England, and there's Jane Howard, our project manager, and Alexis, who's here in the building today with us. And we all work for the National Centre for Creative Health, or NCCH. And it's a charity established formally in 2021. Have I got that right, Alexis? Waiting for a thumbs up. Oh, she's outside. In response to the original all-party parliamentary group for arts and health and their research which they published in 2017, which was the Creative Health Report. NCCH advocates for the sector, and their vision is to advance good practice and research, inform policy and promote collaboration, and to help foster the conditions for creative health to be an integral to health and social care and wider systems. It's very much a strategic level piece of work, understanding where and how to bring creative health together with those large public systems. And that sets the flavour for today, and it's why we're discussing and listening to examples of creative health projects and organisations in the Southwest with the subtitles or language set to health, thinking about the way the NHS looks at the life course. Start well, live well, age well, and die well, and also at a population health approach of place-based working. Our schedule today is a well-stocked buffet of creative health projects and flavours. I don't want to forget the thank you, so I'm including some now. Firstly, to Wiltshire Music Centre for generously supporting us with this venue, and also to Arts Council England for the NCCH funding of the Creative Health Associates programme. I'm going to kick us off with a refresher of what we mean as we use the phrase creative health today. I'm using the definition from the latest all-party parliamentary group publication, the Creative Health Review from 2023. We define creative health as creative health approaches and activities which have benefits for our health and well-being. Activities can include visual and performing arts, crafts, film, literature, cooking, creative activities in nature, such as gardening. That's not an exhaustive list. Approaches might involve creative and innovative ways to shape health and care services, co-production, education, and workforce development. Creative health can be applied in homes, communities, cultural institutions, heritage sites, and healthcare settings. Creative health can contribute to the prevention of ill health, promotion of healthy behaviours, management of long-term conditions, and treatment and recovery across the life course. As you listen and watch today's content, you are welcome to respond with ideas and questions that bubble up from the deep. Please use the link in the chat, which I don't think we have live at the moment, or from your Eventbrite email, in which there is a Q&A form. And for those of you in the room, use the Q&R code on the screen now to scan and to send in your thoughts using the online form. Okay, so you have a refresh of what we mean by creative health and how we're approaching the sessions today. That is the warm-up over, and I'm handing you now to Peter Collins to officially start our Southwest England day trip through creative health.
That was for you, not me, I think. Hello, I'm Peter Collins, and I am lucky enough, I think, to be a clinical leader in the NHS and to have the privilege of trying to shape services that are fit for our population. At the moment, that's the population around here, around Wiltshire and our surrounding counties, but soon to be further down in the southwest in Devon. And I was thinking while Penny was talking, the why. Why are you all here today? What are we trying to do differently and together, collaboratively and creatively? Why are we doing it? And I think it reminds me of in the Southwest. I came to a concert here a couple of weeks ago, Bournemouth Symphony Orchestra, a lovely concert, and I stood and looked back at the audience. And the audience was universally white, 90% made up of people who are over the age of 75, and I suspect fairly affluent, and that does not reflect all of our population. You might be forgiven when you look to that population of thinking that actually, why are we doing anything in the southwest? It's a fairly affluent county, fairly affluent region. There are lots of people who have a life expectancy well into their late 80s and into their 90s. But I think actually if you dig beneath that, you see that there are real pockets of difference. Whilst many people who live in the southwest can expect to live until that age, there is a 7-year difference between whether you are the richest or the poorest in the southwest as to how long you can expect to live for. That's 7 years. We have not made any difference over the last 20 years to that figure. And even worse than that, we've made no impact, and it's getting worse, the difference between how many healthy years that you can expect to live. So how many years can you expect to live in good health in the southwest? And if you're a woman, you will expect 19 years of poor health towards the end of your life on average. And if you're a man, that will be 15 years of poor health. And that figure is getting worse. And the reason for that is we are seeing widening inequalities in the health of our population, the difference between access to services, how we deal with mental and physical health and disability in our communities. And if we keep trying to do the same thing, that will become more and more resource intensive. £300 billion, it's a figure that I can't even conceive. Many countries that are smaller than the UK wouldn't produce, their entire economy wouldn't produce £300 billion, and that's how much we spend on health in the UK every year. In contrast, £500 million is how much the government funds the Arts Council. And whilst that might seem a huge discrepancy, and we can all wonder whether that's the right amount of money, I think it affords a real opportunity for me. When you scratch beneath that £300 billion of spending in health, there is about £3 billion that's spent on education, prevention for our communities. And that is where I think we can make huge differences if we think about doing things differently. Some of the projects that I think we're going to hear about today are ways of thinking how we support our communities through a lens of health, but using the huge talent that sits in the UK and beyond in the creative industry. The people who sit in this room today think differently about health to people like me. I was trained to think in a very scientific, very methodical way about how you intervene in health. But of course, we are all people who are made up of huge different parts of ourselves, and actually how we interact with all of the different art forms that you represent today helps us be the person that we are. Some of the projects that I am more close to have helped me understand that universally, whatever background we come from, whatever culture, whatever religion, race, whether we are rich or poor, we all can tap into a creative heritage. We all understand how to move. We all respond to music. The spoken word means something to us. All of those things can influence how we think, how we behave, and who we are. And I think that for me, understanding and leveraging that will help really shift the dial from pure scientific intervention in health to a much more holistic way of thinking. I've just had my 5-minute warning, which has discombobulated me, but it's all right because I'm coming to the end. So what are the barriers to doing that? And you all work in this field more than I do, and sometimes I am in the privileged position of arguing about where funding goes. And I think that what I observe constantly is there's a translation barrier between the arts sector and health often, that the language doesn't really, return on investment doesn't mean the same thing. Being able to justify why funding should be spent on a particular project can often get stuck, particularly at the moment. We know that we will exist, certainly for the next decade, in an environment where money is tight, government spending will be very tightly scrutinised and controlled. So we have to be very clear that if we're spending the public pound, we're spending it for the right reason. The reason I'm standing up here today is because I believe that spending on creative health, in using the talent of the arts sector to really change things in health, will make a difference and provide a better return on investment than just more of the same. So I encourage you today to really help share with each other where you see your ambition being, what is your vision, what do you see the opportunities are, but what do you see the barriers? The better we understand the problems and the barriers, then the better that we can use our creative energy and talent to overcome those barriers. So I'm really looking forward today, and that's the end of my spiel. Thank you. And now I'm segueing nicely onto the sofa. I was watching Philip Schofield last night on the island, and I'm thinking that I'm going to channel my inner today. Good morning, viewers. So we are starting off, I think I am chairing the opening session, Music Across the Life course. And first of all, I'm going to ask our panellists to introduce themselves one by one. Simeon.
Hi everyone, my name is Simeon Edison Kay. I'm the Business Innovation Manager at Orchestras Live, and I'm here with my colleague.
Hi there, I'm Suri Pillay. I'm the Regional Producer for the Midlands at Orchestras Live, but I'm also fortunate to work with Wiltshire Music Centre as well. You've got
Wow. Morning, everybody. I'm Rebecca Seymour. I have two hats on this sofa, I think. One is that I'm the creative producer for Celebrating Age Wiltshire, and I also work at Salisbury District Hospital within ArtCare, and I run the Elevate programme, which is participatory arts for patients and staff.
Thank you. Hello, everyone. I'm Liv McLennan. Strap in for this one. So I'm a co-director of Sounds Better CIC. We work predominantly in Wiltshire, but also in London with people with long-term health conditions, particularly focusing on lung conditions or respiratory conditions and chronic breathlessness, people living with dementia, people living with Parkinson's, also intergenerational communities and people learning disabilities. And we also offer training in working musically alongside people with dementia. And also, as I'm here as a freelancer as well, also a creative health practitioner, and I work across the life course from birth through towards end of life. I'm a dementia trainer and also a doctoral researcher researching intergenerational music making in care homes.
Thank you. So I'm going to kick us off with a few thoughts, I guess, and then I'm going to make this a bit participatory. Sorry, I shall remember to speak into the microphone around halfway through. So if somebody can wave to me when we're about halfway through, that would be helpful. So we're looking through the lens of music, particularly in this session, and so I'm interested in your thoughts. So to me, as a relative outsider, very talented amateur musician, if I do say so myself. But particularly when I see music used, I see music, certainly in the health environment that I see, very much focused towards the elderly, a little bit focused towards perhaps children and young people, but a big gap in the middle. And I'm interested in your thoughts about whether the arts community have really focused on the whole of the life course or just those two bits. I expect you to sort out your part, just...
No, would be my initial answer. I think it's a really complex picture that we're thinking of, and I'm just thinking of lots of different projects that I'm aware of that work musically with people, definitely across the life course. I think potentially people in the kind of central age group is what I think you're kind of alluding to, maybe have slightly as a rule, less contact with health services, so it's probably slightly under the radar. So maybe that's potentially why you're not aware of, what's going on, because they're not in the hospital or, GP appointments every week. However, in Salisbury alone, I could probably name several different projects that are working, and particularly focusing on mental health as well. So it's there, and I think there's some excellent work going on. But as always, I think that joined up thinking is probably better than working in silos. That's my opening gambit.
I absolutely agree. I think in the hospital, particularly, our musicians that work on hospital wards will work with anybody. So, they might encounter in the children's ward anybody of any age, obviously the children, but the parents and grandparents who ever happen to be the carers of those young people or children. But also, you never know who you're going to meet on a ward. So that connection through Elevate, I think, is with the whole age spectrum. With Celebrating Age Wiltshire, yes, it has a focus on older people, and that was the original plan, but we actually have recognised that doing intergenerational activity, and particularly, I know we're focusing on music here, but with theatre, intergenerational theatre work that we've done in libraries is just wonderful, and a joy to see the interaction from babes in arms right through the parents, the carers, the grandparents, and even the great-grandparents in the same space together. So like Liv's saying, I think the intergenerational aspect of the approach, rather than the modular approach of ages, is the way forward, definitely.
I'm glad you said that, because I agree. I think, a lot of our work is with children and young people. A lot of our work, as you know, is also with your older adults. However, increasingly, our work takes us to rural locations quite often, and so the focus is on community. And of course, that is family units, that is, where people find themselves in their spare time, in their leisure time, not just in their school time. Finding those projects has been increasingly important to our work. And it has reaped benefits in the way of that intergenerational communication. It's really music, let's say in this case, is a tool. It's not the end result. Let's create a fantastic piece of music. It's actually the tool for many, many things, as we know, social cohesion, grandparents telling their grandchildren stories through, music through a conduit. I think we found it to be a very, very rich space. So I will say, yes, maybe we might have been guilty of that. But increasingly, and over the years, the focus has moved very much more towards, because effectively as well, if you would like young people to engage in lifelong creativity, that needs to be supported by a family group and parents that understand what that really is and what that might involve and how they can support those children as well. So even on your kind of sort of learning an instrument level, that support's needed, and then moving through to kind of the other positive impact that can have on people's lives, creative lives, but their general social lives as well.
Can I just add one thing? It feels a bit unfair because there's two people here from Orchestras Live on the stage, so I apologise. But I think that you've alluded to this in your opening. The question is somewhat framing and what lens we're looking at this through, because is something a direct health intervention? Is it a creative health intervention, or is it actually just the health and well-being impact of the general music that people might engage with, which is, obviously huge? And are we even including the sorts of funded music that the Arts Council tends to get involved in, although it's trying to broaden its reach? Obviously, there's music that happens across genres and across traditions. And that's actually the work I'm doing at Orchestras Live. Like, how do we be a bit more sophisticated about how we tell the stories of all of these different things, from the very clinical focused all the way to the what you might call preventative or general well-being value of all music coming to this concert here that you talked about, or participating more widely. So that's why I'm working on impact measurement framework for that's broadly applicable to all music and creative intervention, so that we can say, yes, there's huge cultural and intrinsic value in this work, and there's this amazing contribution to well-being or the social determinants of health.
And I think that that's really helpful, isn't it? So I'm going to try and sit here in a little bit as being the naysayer. So I'm going to ask you, so many people who think about funding in particularly health, and I'm going to look through that lens, would say that creative health, the arts in health, are a value-added thing. They are not intrinsically important to delivery of benefits to the health of the population. And I would hope that nobody in this room believes that, but I so don't throw things at me now. I guess what I'm trying to winkle out, I suppose, is how do we change that narrative? What can we point to that really shows direct benefit that people will understand, that it's not just playing music to people in care homes or playing music to people on the wards, nice as that is, and hugely beneficial that is to their well-being, but what about the direct changes to the cost of health, for instance? Can you help us understand what your approach would be to change that? So, I mean, you've talked about a scientific methodology in a way, which is many health funders would understand the return on investment, the right language. But what other ways can we demonstrate that impact, do you think?
Can I as you're speaking, Peter, many examples come into my head. I think we need to readdress how we gauge and how we quantify or clarify what we're talking about as benefits and development. For example, in the hospital, I started working, I was a dancer originally. When I first started going onto the wards using music many years ago, I would be confronted by all the clinical staff with, "You're going to do what?" And really felt quite fish out of water totally, but because being a creative, you still go, "Yeah, I can do this." And then you get the responses from the patients, and you think, this is really working. And then gradually over the years, the staff, the clinical staff, have started to get it and not think, who's this strange woman coming in and doing this stuff? And now we've seen a huge turnaround of referrals, particularly with patients who might be of extremely low mood or long-term patients, because actually the clinical staff are saying, we don't really know what to do with them because they're not improving their mental health. We may be able to monitor their clinical health, but actually we're not getting them better. So actually we're then providing that creative health support that gives them a holistic feeling of themselves and who they are other than a patient outside the hospital. And that's what the creative arts do, particularly, obviously we're talking about music here, but through the whole creative spectrum. With older people, because of Celebrating Age Wiltshire, and also I was a Dance for Parkinson's teacher for a long time, the difference, and I just used to wish that I could film the people coming into a class and going home from a class, particularly with Parkinson's, because that's my experience, is that people would struggle in, often holding frames or sticks, and be so stressed, so exhausted, so frail. They'd go home, heads high, striding out, laughing. I don't know anything really that gives them that high, that changes the approach, yeah? But I think that when we see our Celebrating Age of Wiltshire, concerts that we do, we sometimes get 80 to 100 older people from the local community in a village hall. And again, they're all struggling in. Then they see their friends, so a lot of it's social time. And, how lovely to see you. And then you can see the physicality, everything changing. And by the end, the feedback and the responses, and also in our original application to the Arts Council when we first started Celebrating Age Wiltshire, we wanted to see that shift and how long that change lasts until the next time. So yeah, those are the sort of illustrations that I wanted to give.
And I'm struck just before, let people collect their thoughts, and there is a danger that I'll talk too much because that's what I do, but I'm struck by when you look at the particular demographics of the Southwest, where we know that we will have an increasingly older population and we will be net importers of elderly people, because the Southwest is a lovely place to live in the main. So we will import lots of people who don't come with that ready-made social structure, and how to create social structures within our communities that are new is quite a difficult thing to do. And I think for me, the arts are really good at being able to bring people together with a common purpose and a common thought and a shared experience.
Thank you. I mean, it's a complex question that I think I've remembered. It's been a few minutes since you asked it. But, there are the short-term things that we can do is try, for example, in my own work, we're thinking about breathlessness, using breathlessness scales, which we do. But it's also important to recognise people's self-perception of that intervention as well. And I think that is really valid, as well as these other tools. And just creating a complex and multifaceted picture. Kind of drilling down into the detail in those grassroots projects, but also in a longer term sense, how do we gain places in medical education, for example? And there's some good work in the medical humanities going on, but how do we get a module on arts and health? How do we gain that in both medical degrees or nursing degrees, as well as the arts degrees as well? How do we work across those sectors together?
I agree with everything that's been said so far. I think I'm not going to start on anything medical, but I did read in the Darcy report that, there was a lot of talk about mental health, and that this is declining, and I think ways that we can kind of, as you say, bring people together and look at prevention, but also creating environments where people feel confident to share if they have concerns about their health, because I think that was another part of it, was people not necessarily going to their GPs, not necessarily seeking the advice in a timely way, even if they can get kind of seen in a timely way as well. But those kinds of environments as well are, I think, just as important in a sense. Let's say if you talk about returns, that it's fewer people, let's say, in a waiting room, or those kind of things. And maybe sometimes having a social setting or a community that you might relate to, or a place that you go to once a week, may reduce visits to see your GP, because you might be going to them for different kinds of reasons. You might be spending time in the Wetherspoons because you can't have your heating on, and so you might be drinking a little bit more. All of these kind of it sounds very sort of granular, but I think those kind of things that we can measure would be really, really valuable. In fact, I've just had a very recent conversation with Laura Waters, who was part of an Orchestras in a healthcare study with our CEO, Sarah Derbyshire, and Matthew Swan and the ABO. We have been talking very much about finding spaces for nursing students, for example, to work with student musicians at Conservatoire, because that is a moment where everyone is slightly more open, you've got a bit more time perhaps, and finding some models that might actually work from both sides. So looking at what let's call it the clinical need, I don't know if that's the right word, the clinical need, but then also, what the musician has in the way of skills to kind of meet that need, because of obviously the different nuances around different kinds of conditions and different illnesses or diseases or conditions that people have. So, I'm really excited about that. It's very early days, but those kind of things I think would be really, really valuable for us to not just evidence what we're doing already, but also find new ways to respond to certain needs within the kind of within the community.
And it feels like that symbiosis is really important, that it can't be a competition between, we do the arts thing over here and we do the health thing over here, and we sort of just look at each other across the trench. How do we start saying, well, actually, if we are doing something creative, what's the opportunity to do a health intervention at that time? Or if we're doing a health intervention, what's the opportunity to do that in a creative way? And I think the more that we can, it feels to me, the more that we can experiment with that, the better.
And it's just going on from that. I mean, it's wonderful having these national-based organisations working together, but that leaves out the grassroots stuff where actually the individual change in people and communities, which is kind of why we're all here, and in the Southwest more regionally, is kind of gets left out. So I think, I make a plea to people to think local, or think global, act local, and to really think who are the people delivering this on the ground, in the wards, in the communities, connect with them, because you have more resources to do that, rather than expecting the grassroots organisations and freelancers and small organisations to kind of be banging on the door all the time. So I think there's a responsibility with bigger organisations as well.
That's such an important point. Yeah, sorry. I think the creative health sector, or the creative involvement in the health sector, actually is just part of the wider cultural industries, that it's so micro organisations and individuals, and then you're interfacing with one of the most sort of monolithic institutions in the country. And actually structurally, talking about barriers, structurally they're almost incompatible, and so there's stuff we can do about evidence and outcomes and all of that, but there's actually just hugely different ways of working and expectations and norms. And from my background as a kind of innovation researcher, that's the single biggest challenge in innovation and change in any sector, in anywhere. So that unless we sort of recognize that, and actually the cost to that, that's really important. But also the other thing connecting all of that is local and specific relevant impacts that ideally are sort of coming from the people participating, but actually aligning that with standardized outcomes and sort of policy-oriented, goal-oriented measures, so that we can kind of both recognize the special, unique flavor of everything, but actually kind of add it up together in a way that tells a more impactful story, and alongside those people's individual stories which change the hearts and minds. So it's kind of like, it's not either or, we've got to get out of it's one way or the other. It's, yes and together, which does take effort and time, but can be done.
Sorry, I just wanted to quickly add that I think as well, just going back to the idea of finding those exploratory spaces early is also very much about having the experience of the impact, and then say somebody that as a nurse can articulate in a language that relates to their colleagues better than I probably could. And in the same way, I can sort of articulate it in my own kind of artistic environment.
And for sure, I think it's really important, isn't it, to remember, I was listening to the consequence of the long-term workforce report in the NHS, which suggests that if it was to achieve its ambitions, 16% of the UK working age population would be employed by the NHS. So the people who work in health are our communities. They are not just the nurses and the doctors that sit over here. They are us. They are in need of health services. They are creative people in their own right. And how do we harness that power as well? And that flexibility of approach that you're describing, I think, how do we celebrate what happens locally, but be able to somehow describe it in a way that describes a bigger impact at a national level? Because the NHS loves the national thing. It is struggling still, isn't it, to understand the value of difference at place and how to connect with local communities. And so it is still very much let's do a scheme from the top down, and that feels like a barrier. So I did signal at the beginning I was going to open it out to questions. So does anybody have any thoughts or comments that they wanted to add from the audience?
A thought I had whilst you were talking about the NHS and the arts. NHS rarely funds the arts that are working in the hospitals. A person or a group that are missing from this conversation are the people that are actually funding the work that we do there. And often they've got their own agenda compared to what the NHS and the artist has. So they're the ones that also need persuading this work is relevant and valid.
And that's a really good point. So, I mean, the hospital charities and healthcare charities often are very constrained, aren't they, by what they will or won't fund, and it's often seen somehow as a discretionary piece, arts in health. And, you know, I've really lucky over the past 4 years to have worked in an acute hospital trust at Salisbury where funding has been relatively generous, I think, and that has reaped enormous, you may not feel that, but it, compared to many places, certainly from where I came before, very, very generously supporting and really being able to see the difference. But it's how do we get those levers to try and persuade people that it's been done over there and it is the right thing to do.
Peter, let me just add that that funding is actually from the charitable trust as opposed to NHS funding. So, yeah, we're very lucky in Salisbury that we have that charitable trust. Yeah. Absolutely.
And I think that was my, that was like the Stars Appeal.
Stars Appeal,
yeah.
thank you.
I've come from UWE Bristol, from an education setting, obviously, and really I feel that the difficulty is trying to find the resources, funding, staff time, expertise to generate the type of research you're talking about, Peter. And I think, so I suppose my question is, how might we help people in your area work more closely perhaps with large educational institutions like mine to operationalise that kind of expertise. So at the minute I'm also doing my own research project which I'm running and also trying to do the analysis, and it's absolutely killing me. And I'm an academic, and this is a problem to solve. So I feel like there's some crossover there. So I was excited to hear about the idea of trainee nurses working with trainee musicians. That's great. At UWE, we do arts and health provision across all the allied health because of the existence of my team there. But actually, that isn't common in higher education at all. And so I also think there's a sort of challenge for us to think about how can we win hearts and minds in the higher education bit where that training is taking place, so that as people come into the workforce, they're coming in and have kind of a sort of one to the idea, and also thinking about how we can tap up funding and particularly leverage expertise so we can get the data that we need to convince clinicians. So I suppose my question is, if anyone has any ideas about how your organisations might be able to interface perhaps a little bit with higher education in particular, so that we can get that ball rolling. Thanks.
I think the Wells City, Salisbury, has a good relationship with, Leslie, you can probably say, I can't remember who the researcher is that's been doing the evaluation work. You joined. So that sorry, I don't know if everyone can hear that because there isn't a microphone there. University of Birmingham.
Burnley. Birmingham.
Yeah.
Oh, I grew up in Birmingham, lovely town.
Yeah. And I think also when we first started Elevate 11, 12 years ago, we worked with Winchester University on a really strong evaluation, which then supported and underpinned the first 3 years of doing the work in the hospital, that then convinced the charitable trustees, the Stars Appeal, to then fund it. And that was definitely that research that supported and underpinned everything that we now continue on 10, 11 years later. So yes, building that relationship.
Frankie Simpkins, hello, is a musician in residence in Bath and sings in the neonatal intensive care unit. And I think points out that point that I think we heard early on, that it is lazy thinking that I was articulating to suggest that that is just for the babies or for the parents, that it is the cohesiveness of the arts. Everybody that listens to that music will have a connection to it, be the staff, the families, all will be able, it enables the start of a conversation that might be different, doesn't it? And I think that is the power of a universal language, is it means different things to different people, and that's fine. You don't have to have a translation for that. It just sparks a conversation. Hospice care, equally, I think, really important part of how, at the end of the life course, how do we die well? And one of my personal nightmares is to have a stroke and be non-verbal and then be stuck on a ward and take that played to me for the rest of my life. So how do we start to have that conversation that says actually individuals have different preferences, and how do we signal that? We signal all sorts of things about how we want to be cared for at the end of our life from a medical point of view, but not holistically, and not what sort of music do we want to be played. So just to anybody who happens to look after me at the end of my life, not take that.
Peter, can I add into something there? What you're talking about is the skill of the musician or the artist, and we discuss this a lot, versus the volunteer. And that's really important because, the volunteer can play all sorts of wonderful stuff, but the professional artist that works in creative health understands that person that's tortured by take that for the rest of their life, and can actually work with the participants to understand and feel the right space. And you understand that completely from Orchestras Live as well, but and your work as well, Liv, that and Frankie, we know Frankie very well, and they're super talented professional musicians that know how to tap into the right work.
Can I briefly yes and that, because I've been working in health, creative health for about 14 years, and one thing that when I started was the kind of a lot of really good work that was happening when I was working in local authority at the time, in youth settings, in care settings and stuff. It was very, very volunteer-led, and there are some wonderful things that happen when you do that. But I think the power and depth of impact that can happen when you're working with creative professionals, is transformative. And I think one of the narratives that happens in the arts sector is like there's the stuff that is apparently not about the art, somehow dirty instrumental or something, because it might be about health. And then there's the stuff that is kind of, the real stuff about the arts. And actually that's a kind of false narrative, and it's a false dichotomy, because the quality of the creative work, whether that's process-led or outcome-led, is directly relevant to the actual depth of the impact. And we see this when we look at how we measure that. But then if I relate that back to the kind of how do we build these kind of constituencies of funders, again, that's why you need to be able to have a kind of common language and talk about things in sometimes seemingly reductive ways, like return on investment or saving to the healthcare treasury, but actually it just lets you kind of talk across some of these different constituencies. And then the final thing I would say is, the other part that we're working on is how do we then aggregate some of this data? Because actually if we then value the local, translate it into national measures, and then aggregate it so we can tell really powerful national but locally relevant stories, that's where I want to get us to get to, going back to what you said at the beginning about vision.
So one more question, and then I'm just signaling to you the end. My wrap-up piece is going to be to come to each of you and ask you to describe what's your biggest ambition for creative health over the next 5 to 10 years, and what do you think the biggest barrier is? So I'll leave that thought to you. Some of the other online comments have been, again, about that feeling to connect to a common thing, such as health and well-being, that people in other sectors might understand better, and also that value of connecting up but not losing the local difference, but being aggregating into a bigger collective whole, I think, that we've talked about. But one more question.
Thank you. Mine's not a sort of question on stuff. It's almost a yes, but regarding volunteering and volunteers. And I think there's something about understanding that many of the volunteers we work with are hugely professional. I think volunteering has changed. I think that a good volunteer program manager will handpick incredible volunteers. So for me, it's a yes, but a kind of, and I think, having worked in hospice care for 14 years as a creative health practitioner, without my really strong volunteer team, I couldn't have delivered to every single patient that we work with. And I think we did something like 73,000 hours of volunteering around creative health over a 2-year period. So it's a kind of, I hear what you're saying, but it's a yes, but. Thank you.
Can I just say to that as well, I totally agree. In a lot of our work, there is a question about what happens in between the projects. There's a lot of that sustainable, engagement that can really, really make a massive difference when it's done within the community and by volunteers that come from those communities and understand them better than us coming in and swooping in and doing the work on a project kind of by project basis. So I would totally agree with that comment.
And feels a really important point that not everything costs money, but it usually costs money to harness those those people. So that return on investment, having one person to galvanise the efforts of a whole community, is a huge return. You saw the 1 minute thing, so it's going to be very brief.
So the ambition is a well-understood, researched and resourced intervention, this is arts and creative health, that is integrated into health, education, community and systems. And the biggest barrier is a kind of short-termism approach, I think.
I think my long-term ambition is more of the micro work, particularly citing our Creative Conversations programme for celebrating Age Wiltshire, but also the work we do one-to-one in the hospital. It's just so transformative with particularly ageing well and dying well, that detailed work there. And I think I do have to say, yes, the short-term understanding about funding versus the long-term impact of being able to run a programme for a long period of time. Yeah.
Well, I was busy talking when I was supposed to be thinking. So, straight off the top of my head. But I mean, I think for me, it's very much about preventative and mental health, and that there's a deeper understanding of, on all sides, of the actual impact that can have. We've started some work with unaccompanied asylum-seeking children and young people, and with the support of Arts Connect, going back to the higher education question, the University of Wolverhampton research team, Arts Connect and the Mighty Creatives, and virtual schools across the Midlands, that's just such a wonderful place to start. It would be fantastic if all of our projects were resourced in that way, so that we can do all of those things and have the capacity to do it. I think that would be, and looking at kind of, how we can, I think that question of living well is so important for me, and would be that kind of, whilst we're here on this planet, let's have all the benefits that we can do, and have the richest time that we can possibly do.
I'll be really quick. If you look at the way that policy and measurement and action in the environmental realm is far, far, far from perfect, but actually has kind of a very collaborative approach with some very well understood measures and very widely accepted approaches. Politicians might not be implementing them. How can we get there with a really nicely integrated cultural and health sector where the kind of prevention aspect is really fully understood and invested in, and I think we have to be part of that journey into telling that story.
Thank you. And my final reflection is, I'm interested in this subject, and I don't even know the breadth of the work that's going on in the organisation that I've worked in for the past 4 years. And so how do we get to a point where there is a much better understanding of all of this work, how we can use the arts both in prevention of health, but also in the treatment of ill health, prevention of ill health, I meant, obviously. And the barriers really are that it feels like there is no big level advocacy here. And I guess my challenge to Penny would be, how do you and the group that you represent really understand and get to the right people? There are, I suspect, as many politicians who are interested in the arts as there are doctors who are interested in the arts, or nurses who are interested in the arts, or indeed artists who are interested in health. And how do we bring those together to really understand what potential there is in doing this work faster, better, and more in a more organised way? So thank you to our panellists very much.
I think while we readjust the room, we will go with live music now, who couldn't be here today, and have their lovely video. Is that all right, Sarah? While we bring libraries and heritage and hospital history to the stage, please.
So I wrote Annie a letter, and in this letter we do mantras daily, so she knows she's strong, she's beautiful and powerful, because these are things I didn't know when I was growing up. So I want her to grow up knowing that. Because I have anxiety, I didn't think my ideas would be good enough, but But then when I actually got into it properly, it feels empowering, it feels strong. It's just so lovely to have something so nice to give to Annie. I'm very, very happy. It feels warm. It gives me a funny tingly feeling, which is a good thing. Annie loves it, and she danced for the first time, which made me so happy.